Good morning, friends. Myself, Dr. Srinidhi Kumar Acharya. Welcome to my YouTube channel, Clinical Medical Classes by Srinidhi Kumar K. Please subscribe my channel and also give your valuable comments. So, as we have seen, we have already dealt with all the details of Shayya mutra, and we have also seen the causative factors, etiological factors, then clinical symptoms, presentations, and also the way of questioning with the parents, counseling, and also Ayurvedic management and Ayurvedic understanding of this disease Shayya mutra. Today we will have some of the clinical case studies related to the same and its Ayurvedic management. So let us start with the first case. Now the first case is a 5-year-old boy is brought to the office or OPD by his mother because of recurrent bedwetting at night. He has a 3-month-old sister who is healthy and physical examination is normal. And some urine analysis was done as advised by some of the physicians, and that shows that specific gravity is 1.010, and it is negative for protein. Urine is negative for the protein, and also it is negative for microscopic RBCs, and it is also negative for sugar. Which of the following is most important information to share with his parents? So this is a clinical case scenario. Now we have to decide which of the following is most important information to share with his parents. Now as a doctor, what is the most important information or the matter that you have to discuss with the parents? This is a finding. Okay, so he has got a 3-month-old sister who is healthy. Now this is a 5-year-old boy, is a male. We know that in males Shayya mutra is always more. Okay, so 5-year-old boy brought to the office by his mother, and 3-month-old sister she is healthy and she don't have such problems. And this boy's urine analysis was done. Specific gravity is almost all okay, and then negative for proteins, and it is also negative for RBC. It's negative for sugar also. Now let us how to proceed with this case. This condition will seize us. Now out of these 4 options, which of the following is correct, and then we will proceed. Do you think that this condition will seize us if they reprimand him for deliberately wetting in the bed? That means, do you think that if the parents give some sort of mild punishment or some restrictions, okay, to the child, so that he should not do, so he will be get corrected? Do you think this is the right answer? I think it is no, because this type of behavior is totally contraindicated in case of Shayya mutra. Do you think this is potentially a serious problem, and it could represent the chronic inflammation of the kidney? Do you think that by looking at the urine analysis and all these pictures, do you think that there is some big problem in the kidney and it requires some other treatment? No, because urine analysis is almost all normal. Do you think that this is a precursor of the diabetes, 5-year-old juvenile diabetes mellitus? No, because urine sugar is also normal, so there is no such things. And do you think this signifies a serious emotional problem? Such emotional upset symptoms are not there. Okay, it is not even an emotional problem also. Now what exactly the possibility? Possibility is this condition is self-limiting. Now in this case, this condition is self-limiting, and they should take care to lessen the emotional impact on their kid, because what is happening here is parents are every time comparing with the younger sister. She is getting normal, she is very normal, she is active, she don't have such problems. She is a female, and now this is a male boy and 5-year-old, and he is still having that problems of Shayya mutra. Okay, so what is happening is they are comparing with the younger sister, and that is causing some sort of emotional impact on the child. Now the best advice in this situation is, in this condition is self-limiting, because child is only 5-year-old. 5-year-old is a borderline area, okay, a period, okay, because after 5 years, if the baby passes involuntarily in the bed, urine passes in the bed, nocturnal enuresis, then we will call it as Shayya mutra or nocturnal enuresis. He is just 5-year-old, so problem is not so much serious. It may be self-limiting. Okay, so let us see, so this looks like a correct option. Okay, this condition is self-limiting, and parents should take care to lessen the emotional impact on their elder child, and they should not compare him with the younger sister, and they have to give the confidence to him, and that's all what they have to do. Let us see. So how you manage this condition in case of Ayurveda? Yes, child is 5-year-old, and this is exactly the time where we are able to diagnose it. First, we should see whether it is a primary or whether it is a secondary. So in this case, it does not look any primary cause, because there is no any congenital problems, or there is no any structural problems detected, and also there is no much problem with the toilet training, because parents are aware, so maybe they are doing it. So but emotional, that comparison, this is a growing period, and maybe within few months so he will get out of this problem, and what is required is emotional support should be given. So how best we can treat in Ayurveda is, so just go for administration of some of the Medhya drugs, any of the Medhya drugs preparations, and implement the concepts of Sattva Vijaya Chikitsa, so that its emotional stability will be normal and should not be get bothered with all these things. And also we have to educate the parents regarding increasing the dhairya and smriti of the children or child. Okay, so you make him involved in different activities. Don't scold him for one day passing the urine at night. Okay, so give him award methods, or you can go for gift methods or rewarding methods. Even LRAM method can be also tried, and just administer some of the Ayurvedic Medhya drugs along with all these activities, and he will come out of this problem. Let us look at the clinical case scenario 2, second case. He is an 8-year-old boy. He is brought to see you because his parents are concerned about his lifelong history of bedwetting at night. 8-year-old boy, okay? Lifelong history. That means that since birth he has not attained the dry nights. Okay? So this behavior occurs on an average of 5 to 6 nights per week. In a week, about 5 to 6 times in a night he is passing. Okay? Almost all every day. So however, he does not have any daytime wetting and incontinence. In daytime he don't have any problem. But the problem is only in the night hours. His parents have tried several tactics, because they might have been visited so many physicians, and they explain different types of methods to stop this behavior, including the fluid restriction from even after evening hours, night awakening, then LRAM methods, and then reward method for dry nights, and everything has been tried, but there is no any positive result, but the behavior is continued. So the boy had no any medical problems. Otherwise this boy has got no any medical problems and doing well in the school and with his friends. He is very jolly, and he is pleasant, and he is communicating with his friends very normally. Socially he is not withdrawn and all, and he is not bothered much about this problem, although parents are worried. And otherwise he has got no any medical problems. All the physical examination of this boy is also normal. Now again, the option is in front of you. Which of the following is diagnostic and therapeutic strategies in this condition, which is most reasonable? So what we can do next in this case? Yes. Now actually in this studies, no further, these are the 4 options, and which one you will prefer? You say that there is no further studies and a trial of imipramine should be given. That means one of the contemporary drug, a antidepressant drug. Okay, this is one option. IV pilogram and moisture sensitive LRAM at night should be done, because these things are tried already. Okay, both these already the physicians have given these medicines. Okay, and then reassurance that he will grow out of this behavior should be tried. Then urine analysis and use of moisture sensitive LRAM at night should be tried, and urine analysis and trial of imipramine should be tried. Now out of these all options, as they are fed up of this problem, parents, so they might have been visited so many physicians, and they might have been given so many all these options. Okay, now everything has been filed, now it looks like we have to look into one simple investigation, that is urine analysis. You have to look into it. So urine analysis and use of moisture sensitive LRAM at night may help in this condition. Because it looks like a genetic tendency of what you say, Shayya mutra, and we have not taken, there is no history of father suffering, and we have not taken that history. If you take that history, if this history is available, then it can be a condition of genetic tendency, or it may be a condition of nocturnal polyuria. Nocturnal polyuria means when this much of medicines were given, it might have been corrected to some extent, but there is no improvement. So it looks like a genetic tendency. Let us see. So if that is the case, if it's a genetic tendency case, the best way is to confirm other the absence of other infections and all those things. Go for urine analysis and go for moisture sensitive LRAM therapy at night. Okay, so how do you manage in terms of Ayurveda? So again, it looks like a genetic tendency related Shayya mutra. So best way of management is again administration of some of the Medhya drugs. It may be in terms of Ashwagandha, Saraswata, or whatever things, and we can also try with the bladder control methods. Okay, bladder control. Some of the drugs which are having increase the tone of the bladder muscles. Okay, like it may be Kupilu or some other drugs, Vacha. So that can be tried, and then we have to go for Sattvaja Chikitsa. We have to implement the Sattvaja Chikitsa at various stages, and involve this child in various activities which gives a positive energy or positive thinking or positive attitude to this child. Okay, now very important in this case is make the bedtime very pleasant. Okay, now management in terms of Ayurveda, when we talked, the management during the bedtime is very important. Make the bedtime very pleasant, and in the bedtime you ask him to write 10 times that today night I will not going to pass the urine, today night I will not going to pass the urine, like that. And here very important is child should be made aware of his problem, because parents are worried but child is not worried here. Okay, so you make him involved in this particular condition, and also involve him the next day cleaning process. When you clean the bed sheets that he avoided, so involve him in this cleaning method also. So okay, so first you make him aware. So this is the best management that we can give in Ayurveda along with some of the drugs. Now go to the third case. A 2-year-old boy is brought to the emergency department because of increasing and profound lethargy during the last 4 hours. Child was absolutely normal since last 4 hours. Since last 4 hours, the child is having lethargy. 2-year-old boy. Okay, there is no any past medical history for this boy. 2-year-old boy. Okay, I am telling. Now, however, in their home there is a 7-year-old brother. This boy's brother, who is 7-year-old, he is a known bedwetter and has the upper respiratory tract infections. Identify, see, carefully you see, actually parents brought the 2-year-old boy with the complaints of lethargy since last 4 hours. In their home, another elder brother is there, and who is a known case of bedwetting. Okay, and now at present the bedwetting is there with that 7-year-old boy, and he has got no other problems except bedwetting. But this 2-year-old boy who was normal, now he started lethargy. Okay, looks interesting. Okay, so there have been no other contact with the individual who are at sick. So this 2-year-old boy is not in contact with, not came in contact with any of the sick people and all. On physical examination, child's temperature is 37.4 degree Fahrenheit, and he is noted hypotensive, quite hypotensive, quite interesting. Nothing is happening to that 7-year-old boy. Everything is happening to 2-year-old boy. Okay, there is no history of trauma. The cardiac monitor demonstrated ventricular arrhythmia, ventricular dysarrhythmia, and the child begins to have a seizure now. Now, which of the following is most likely to be a cause of the child's problem? Bedwetting child of 7-year-old, he is only having bedwetting and he is okay. But this 2-year-old boy who was normal previously, now since last 4 hours, he started with the problem. Do you have any connection with this in relation to Shayya mutra? Let us see. Do you think it is a shaken baby syndrome? Do you think it is a meningitis? Do you think it is congenital heart disease? Actually, this is a message for the parents also, and also for the physician to look into what is actually happening here. The 7-year-old boy who was having bedwetting has been given with the contemporary drugs like imipramine, which is antidepressant drug. Okay, imipramine-like drugs. Now, accidentally, the 2-year-old boy has consumed that imipramine, which was kept for the 7-year-old boy, and as a result he started with all these symptoms of cardiac compromisation, then hypotension and all these things. So this is again just a message for the parents and also physician that this can also occur. Okay, 2-year-old boy, he don't know much about the problem. Okay, some tablets were kept there and it was taken by him and he started the problem. Of course, this is an interesting case. Okay, so management in Ayurveda, yes. 7-year-old boy has to be managed in terms of Ayurveda by different the tone increasing drugs, muscle tone increasing drugs, positive reinforcement treatment, and then administration of the major drugs and so many other things. Okay, but anyhow, except that only care should be taken. That's the message. Now we go for the clinical case studies 4. If 8-year-old boy has been presented in front of the pediatrician with a sudden development of nocturnal enuresis since last 15 days. Okay, 8-year-old boy. That means sudden development of nocturnal enuresis means so far he didn't have any problem. Now he has the problem since last 15 days. So he is wetting the bed almost every day now since last 15 days, which is previously he is not doing it. Previously was absolutely fine and now he is doing this. His mother is a teacher. Okay, his mother is a teacher who took care of all the 3 kids since beginning. Since beginning, they have got 3 kids and all the 3 kids are taken care by her mother. And her father is working in the army. Father is working in the army, who recently retired and come back to home at the age of 38, 39 or maybe. He retired from the army and he now come back to the home. All other systemic examination of the child is normal and the child is reasonably good in academics. Okay, his father daily involves him in many physical activities because he is an army returned, so he is a disciplined person and he is involving her kids in many physical activities like exercise and then maintaining the discipline in day-to-day activities and all those things. So now he started some new rules in the home after returning back. Okay, previously they were with the mother in a very relaxed manner, and mother has to take care of 3 kids, so she is also not bothering about all these things and they are doing a very pleasant and happy life. Now after returning back of the father who is working in the army, now he want to keep the children in some discipline, maintain some discipline. Now then let us see whether it has got some relationship. And he has got 2 elder sisters of 10 and 12-year-old and they are doing well. Okay, so this boy is 8-year-old. Other 2 children are there in the home, 10 and 12-year-old. They are reasonably doing well. They don't have much problem. Now, what is the most common cause of this problem? What is the most common cause of this problem? Okay, so this likely to be because of a sibling problem. Okay, now there are many issues are there here. Number 1 is some new rules are implemented in the home, which was very new for the kids, and 2 of the kids were adjusted for that. 1 kid was not able to adjust for this new rules of discipline by the father. That's the cause number 1. Number 2, as they have got 3 kids and mother is the only person who is looking care of them, she is not able to give the proper toilet training to these kids. Okay, and the other 2 were doing it very normally, but the father is the one of them is get affected. So child underwent the wrong childhood practice and there is a sudden change in the daily routine and development of the stress. So in this case, again, the problem is very clear. Improper toilet training which is given by the mother as she is very busy. And number 2 is some sudden implementation of rules and regulations so that child is not able to cope up, and as a result there is formation of this result in stress, and because of that now child started suddenly with the enuresis, and this is a regressive type of or secondary type of enuresis. Now again, what you have to do in terms of Ayurveda? Yes, now counseling is very important. Sattva Chikitsa should be given here. Okay, so first give some Sattva Chikitsa to the father also and tell him to implement the rules in a very mild way. Don't go for aggressive correction of the fault habits of the child. And number 2 is increase the confidence level of the child. That especially increase the rapport with the father. Okay, father has to spend some pleasant time with the child, and then only in a step-by-step way you implement whatever you want to do. And meantime, child should be given with some of the achar rasayanas, and give some autonomy to the child, and also give some major drugs, okay, for the psychological stability. That's all what is required here. Very important is understanding the cause is important, whether it's a secondary or primary and all those things. That is very important. Now we will go for the clinical case studies 5. An 11-year-old boy visited the pediatric clinic with the complaints of recurrent episodes of bedwetting, which is present since birth, with few days of gaps in between, as for the parents. The child was born with a normal delivery. Urine analysis was done and negative for bacteria and proteins, etc. So child is good in studies and has got 2 brothers who were smaller to him. All the other systemic examination is normal, except a small scar in the lumbosacral area was observed, which was painless, and there is no family history of the same in the family. So what is the most common cause of this problem? Yes, this is what I am telling. Identification of the cause is important. Child may come with the various causes of nocturnal endodosis. Now in this case, 11-year-old boy, elder boy, almost or an elder boy, he visited the pediatric clinic. That means he has got this problem of recurrent episodes of bedwetting, which is present since birth. Since birth it is there. Okay, within few days of gap in between, as for the parents. Somewhere for few days it was not there, then almost all it is there. Okay, normal delivery was there, and urine analysis was done and negative for bacteria and all. Child is also good in studies. The only problem is daytime also he has got this problem, but he used to manage because he is a good boy, intelligent boy, and he can go to the toilet and he can pass the urine. But night time he has got this problem since birth itself. On doing the physical examination, you find a scar in the lumbosacral area. A scar in the lumbosacral area suggests that there is some surgery has been taken place for this boy in the early childhood time. Parents may give this history, parents may not give the history, but a scar always suggests some surgery has been taken place. So lumbosacral area, there is a scar, and child is also passing urine involuntary in the night hours. It suggests there was a midline defect like meningocele or meningomyocele or spinobipedal-like condition for which he has been operated, and as one of the complication of this meningomyocele operation, so that is incontinence of the urine. It may damage the nerve sometime for the bladder emptying and all. It may damage the bladder emptying nerve and some of the lumbosacral plexus nerve which is supplying to the bladder area, and that looks to be a probable cause in this condition. Now you have to treat accordingly. Accordingly you have to treat. In Ayurveda, what you can do? Number 1, consider this as a surgical problem and complication of the surgical problem. Okay, so now in this condition, instead of giving major drugs, and you have to go for increase the drugs which increase the nerve regeneration. Maybe the Prasaran Taila Matra Basti can be tried to some extent. Mutra Sangrahaniya drugs can be given to some extent, and the drugs which increase the muscle tone can be given, like Kupilu, etc. can be given in this case. So understanding the cause is very important before going to the treatment. Go to the case number 6. A 5-year-old female child comes to the pediatric clinic with the complaints of frequent passing of the urine. This is a female child. Shayya mutra is more common in male. Okay. And she is also having daytime incontinence, and the vaginal area is always wet, and there will be some dribbling of the urine. That means the vaginal area hygiene is not up to the mark. Okay. So same is continued in the night hours also. Okay. So she is also having daytime incontinence. Look at the case. Okay. And he is also having the nighttime problem. And vaginal area is not clean. So mother maintain a hygiene of the vaginal area promptly. Mother is telling that she used to maintain the vaginal area hygiene very promptly. And then the child hasn't gone for a urine analysis, because urine analysis must in any cases. And that is normal, and blood investigations are also normal. Okay. Child is very much disturbed by this during the daytime routines, because she is a female child. So she has been disturbed by this particular daytime urination. Okay. So frequently she is passing the urine in the daytime. In the night time she is passing the nocturnal endodosis. Okay. So what is the most common cause of this problem? Now, we will go for proper training method has been, we will go for proper toilet training method which has been disturbed. Okay. Maybe proper toilet training was not given, that may be the case, but daytime incontinence is also there. Okay, so we will go for which of the following is right out of these 4 options, then we'll proceed. Toilet training is the problem? No, if the toilet training is the problem, she should have the problem in the daytime also, but in daytime she is going and she is passing the urine, but she is disturbed. And we will go for a thorough past history and family history of the parents. If at all the family history has to do something with the only nocturnal enuresis. This child has got daytime problems or daytime frequency is also there. Daytime urine frequency is also there. So this may not be the good option. We will consider some of the gastrointestinal infections as the cause. No, if that is the cause, gastrointestinal infections may be there. Okay, that is the cause. Then there should be vomiting, diarrhea, abdominal pain. Such symptoms should be there. No, this is also not the cause. The best option is it is better to go for a urine analysis and a urine sugar to rule out the other causes. Yes, this may be. We will go for one urine analysis and we will rule out some of the important other causes. Maybe diabetes insipidus, diabetes mellitus, or some other infections, urinary tract infection, etc. So this is actually a case of urinary tract infection. Child is having urinary tract infection because vaginal area is also not hygienic. Okay, so although mother claims that she is cleaning it, that area is not hygienic because child is frequently passing the urine even in the daytime also, and then she is washing and that area become wet. So it's very difficult to maintain the vaginal area hygiene, and in this case that is a cause. So now what is the best thing? Again, how to manage in terms of Ayurveda? Yes, you have to go for prompt treatment of urinary tract treatment. Okay, urinary tract infection. Urinary tract infection can be treated by Shweta Parpati, or it can be treated by Trinapanchamooladikvatas, or as a physician we know different options. Okay, we understanding the cause. So if urinary tract infection, to maintain the pH of the urine, you can go for Shweta Parpati. Okay, so that maintains the alkalinity of the urine, and similarly to maintain the non-infectious infection for sterile state of the urine, so you can go for Trinapanchamooladikvatas or some Chandraprabhavatis. Okay, Gokshurati. So different medicines can be given. That's all. Then to maintain the external hygiene of the vaginal tract area, you can go for cleaning with the Panchavalkala Kashaya Kvatas, or you can have a cleaning with the water process with the Tankana Jala or Spatika Jala. Okay, or Triphala Kvata or Nimbapatra Kvata can be used to maintain that. Then to decrease the urine frequency, so we can go for some of the drugs which are mutra sangraniya drugs, and this looks like a correct way, probably a possible way of management of this condition. Another case is case number 7. A 6-year-old boy has been brought to the clinic with the complaints of passing urine in the bed since birth. Since birth he is passing, and parents were very upset by this. Parents were very much upset by this. So they also give the history that child is also passes urine in nappy during the daytime many times, and its frequency in daytime is also increased. So complaint is they also give the history that child also passes the urine in nappy during daytime. That means daytime incontinence is there, and its frequency in daytime is also increased. Its frequency in daytime is also increased. Nighttime anyway he is having the problem. Child was also observed that weight is coming down. Child's weight is coming down, and there is a more intake of water. Okay, there are also frequent nausea episodes. Okay, now how we will manage this condition further? Now, by looking at the history, see that therefore I told understanding the cause is very important. Now, looking that the child is getting the weight down. Okay, he is passing more urine in the night hours and also in the daytime. There is also some additional symptoms like nausea. Okay, and everything is there. So now this is must be investigated, and this urine analysis should be done, and it looks like a case of diabetes mellitus, juvenile diabetes mellitus. So this is how a proper history, physical examination, and understanding the cause when you are dealing with a case of nocturnal enuresis is very important. Now think about Ayurvedic treatment. Yes, you have to treat in terms of diabetes mellitus. Suppose the child is having diabetes mellitus, then you have to go with the treatment of diabetes mellitus, that is prameha, jata pramehas or acquired pramehas. You have to treat it accordingly, and then treat the symptomatic treatment by means of Ayurveda, which is required. You can give some of the hypoglycemic drugs. which induces hypoglycemia. Of course, if the juvenile diabetes mellitus means insulin is not produced, now we have to focus on that why insulin is not produced, maybe autoimmune pathologies or some other pathologies, and accordingly we have to plan the treatment in terms of Ayurveda. Next, another case is case number 8. 8-year-old male baby was lying in joint family. So there's a spelling mistake. 8-year-old male child was living in a joint family and is doing well. Okay. Recently he started with the bedwetting, not stated, it is started. There are a few spelling mistakes in this slide. Recently he started with the bedwetting, for which the parents visited to the doctor. Child also complains of burning micturition and also urgency of micturition at times. So child used to spend his evening hours with the grandparents at evening hours, who always used to take him to nearby park, and grandfather is admitted in the hospital due to some illness. Okay, that means child is spending some more time with the grandfather, and since few days a grandfather is also taking the child to the park at evening hours, and now grandfather has got some illness and he is now admitted in the hospital. Okay, there is some clue regarding contamination and all those things. Okay, physician advised urine analysis. CT scan was also done to rule out any structural, congenital or some other problems. There is no family history of the parents passing urine in their childhood time. There is no positive family history. Now, which type of enuresis is this? He is doing absolutely well, but recently he started, therefore it is the regressive type, no doubt. And in the regressive type, again, is it psychological? No, because grandparents and everybody is taking care of the child. But child is having burning micturition. So it is not simply passing the urine. Child is also having burning micturition and urgency of micturition. So there is some sort of infection taking place. In support of this, grandfather has got some illness, and child used to spend maximum time with the grandfather. Okay, previously. So this looks like again a urinary tract infection. And in terms of Ayurveda, again we have to treat on the line of urinary tract infection, and that is again the Shweta Parpati, it may be Trina Panchamula Kvatas or Panchavalkala Kashayas or some other Kashaya preparation, Shadanga Paniyas. So these are the different treatment modalities to treat the urinary tract infection in case of Ayurveda. So yes, this is the answer for the same. This is a secondary type of enuresis which is probably developed after grandfather's illness. So this is complicated type of enuresis, as there is so many other associated symptoms also. Okay, so this may be a case of juvenile diabetes also, but the urine analysis will clear the things. But in this case, it is very clear that it's some related to some infection. Most probably, child has got now urinary tract infection. Yes, a 4-year-old boy is having complaints of bedwetting. Then treatment of choice is, see, age of the child is 4 years. 4 years is up to 5 years we will not consider as enuresis. Only after 5 years if the child is passing at night, then only it is considered as nocturnal enuresis. This is a 4-year child. So they have given the options. You want to go for no treatment option, or desmopressin, imipramine, or conditioning therapy. Yes, nothing is required. Only proper toilet training and sattva ujaya chikitsa and some of the major drugs that has to be given to the child. Things will be right. Another enuresis associated with that means sometimes parents will have confusion. Enuresis is also caused by increased bladder capacity, or tight underwears, or bicycle riding, or sometimes urinary tract infection. Out of these 4, it is urinary tract infection which is correct. These are the myths regarding the Shayya mutra. Increased bladder capacity will not cause this if the child is normal. Tight underwears, nothing to do with this. Bicycle riding, nothing to do with this. Okay. So anyway. Now, only nocturnal enuresis in 8-year-old boy is most likely to be associated with. 8-year-old boy is there. Only nocturnal enuresis. There is no daytime problem. Okay, daytime urgency, frequency, nothing is there. Only nighttime enuresis is there. 8-year-old boy. Do you think he has got genitourinary structural abnormalities, or genital urinary tract infections, or childhood psychosis? All the 3 are wrong. And this type of condition, this is because of, we have discussed this case, only because of pure family history of the enuresis. Genetic tendency. There is a genetic tendency. Okay, genetic tendency is there. So when only nocturnal epilepsy is there, no other symptoms, no daytime problem, no other behavioral issue, he is okay in the studies, he is okay in academics, he is okay with the friends, but still child is having nocturnal epilepsy. So this always suggests that this is a genetic tendency problem, and this has to be corrected by some of the drugs which increase the muscle tone, bladder tone increasing drugs like Upilu, etc. Then Medhya drugs, and correct application of Sattvajoy Chikitsa and conditioning therapy, different conditioning therapy like prayers, then inculcation of Achar Rasayanas, involving the child in different activities like this, and all the Sattvajoy Chikitsa protocol has to be followed in this case. So these are some of the case studies related to Shayya Mutra and its Ayurvedic management. I hope this is quite useful for you in your clinical study. With this, I conclude. Don't forget to subscribe my channel and also give the valuable comments. We will meet in another class. Thank you very much.